So Becky, let's talk about your grandson, who is now 3, and he's also a patient, and has actually been a patient since he was an infant.
Yes.
So let's talk about how that came to be.
He may be on the spectrum for autism, we don't know, but he's all boy and extra. And you've been treating him. And the protocols are so simple that he loves taking the protocols. It's a drop of water under your tongue.
Yeah.
Wait a couple hours, have another drop.
Now, speaking of your grandson, so he was nonverbal for
A long time, till he was over 2.5.
Yeah. And then right after the protocol, it just literally
He started
changed. Yeah.
He became chatty Cathy, yes. He's very chatty now. I think he saved it all.
Yeah.
But he's had, I think he's had 4 or 5 protocols since you started working with him. And his health is really good. In fact, we delayed giving him immunizations for a while because, well, number one, there's some family issues with medical insurance and things like that, but also because he was so healthy.
Sure.
And I didn't want to introduce anything into a system that might cause a problem. And you know, we're all familiar with how immunizations work. And so some of those things I just didn't want to take a risk of from the beginning, because he started out as an at-risk baby anyway.
Sure.
So she's in recovery, but he had to detox after he was born, and so that was rough on him too. But yeah, we seem to be seeing a lot of good development with him, especially cognition. His cognition is off the charts.
Yeah.
And his energy levels. If you could work on making him sleep more. No.
We can certainly work with that.
I think every parent of a 3-year-old wants that.
That's true.
Daddy.
You know, I remember when he was like an infant.
Yeah.
And he was really suffering.
Yeah. He was having a hard time.
And he was having a really hard time. And I think after the second or third protocol, maybe?
I think the second one.
After the second protocol, he just calmed down. Like, you brought him in, and he was in the room while you were getting treated. And he was just so calm and so easy after that. Even I was just really blown away.
It's true.
But what a change it was, because the poor little guy was really, he looked like he wasn't doing well. He was crying a lot, and very fussy. And
yeah, fussy.
Yeah.
That's true.
Yeah.
And that was kind of his nature for quite a while when he was younger, as an infant for sure.
Yeah.
But the change has been so dramatic in him now. He's so healthy now. He's too healthy almost.
Yeah.
I mean, if you can have a child that's too healthy, that'd be him.
Yeah. Wow. Yeah. He runs around and he's kind of a chatterbox.
Yeah. He is, and speaks his mind. Like I said, I think the most important, one of the major things I saw was his amazing cognition since he started receiving the protocols.
Yeah.
And also the calming effect it seemed to have on him.
Yeah.
So that he could function in other areas.
Sure.
Which was good, like sleep and, socialization, things like that.
So I don't have to ask you if you would ever recommend, because you have been recommending me to so many people, which I deeply appreciate. Well, I'm glad that you're doing so well. I'm glad your grandson is doing better.
I know.
Yeah. And again, Becky, I so appreciate you coming down this far to tell your story.
It's a story that I believe in. It's a story that I wish other people knew how simple it was to have health this way.
Yeah.
And I really appreciate you and your dedication to being the pioneer in this area with that, because it's really changed some lives.
Yeah.
Already.
I know.
And I'm excited to see what happens in the future.
Yeah, me too. Me too. Okay, thank you.
You're welcome.
Brannigan Health, naturally.